Well, what I want them to experience is when they come here, despite if they have any kind of anxiety or just kind of a certain kind of expectation, I want to exceed whatever kind of expectation that they have. Some people are very nervous, and when they sit in the chair, by the time we are done, they're like, oh my gosh, this is not as bad as I thought it was at all. Matter of fact, I'm actually looking forward to kind of coming back next time. That's the kind of experience. I want them to leave this office knowing that they can come back and have a great experience, just like this every time. Much like some of our favorite restaurants or some of our favorite places where we like to patronize, we go there because we have an expectation that it's going to be just as good as the last time. And for us, our standard is not what anyone else sets. It's for our own standards and our own previous visits that they've had with us. We want to exceed even that every single time. My own experiences with dentistry and the difficulties of sometimes coming into the office, for me, it goes all the way back to when I was about 3 or 4 years old. I came here as a refugee and from the mountains of Laos. Up in the mountains of Laos, we don't have dental care. We don't have dentists. We don't have toothbrushes or any of these nice things that we have here. What we have is just our general sugar cane and a lot of cavities. So when we came to the States, that dentist had quite a job to do. He had to help me to get rid of some of these teeth that were very problematic. And being a young child at the time, not even understanding any English, it was quite scary. And him having a job to do, and he had to kind of hold me down in order to get the job done. And being as fearful as I was, I struggled even further. And needless to say, at the end of the appointment, I left the office, pretty numbed and got the job done. But unfortunately, I do remember that experience to this day. And in many ways, that's something that really helps me to sympathize and to empathize with some of my patients who have had these prior experiences. And I want them to help them to understand that going to the dentist, coming to see me, doesn't have to be this way.